What people may not realize is mental and physical health are connected. The relationship between mental and physical health holds more importance than many realize. The point can be found that mental health and exercise have a relationship of their own. In their lifetime, approximately 26% of Americans will experience a mental illness in their loved ones, varying in degree. Mental health is also much more prevalent amongst Caucasians than any other race. Many people know at least one person in their life struggling and fighting against a mental illness. Around the same amount of people participate in physical activity. According to the Center for Disease Control and Prevention, about 23% of adults over the age of 18 meet the physical activity guidelines for aerobic and muscle strength training activity. This means if people who struggle with mental health took part in exercise, they can improve their quality of life. Exercise decreases stress. Exercise is a healthy way to cope with stress. While chronic stress occurs, the brain proceeds to produce more cortisol than the brain can use. This can lead to several physical health problems. Exercise helps burn hormones and relax the muscles and mind. It increases blood flow to the brain and raises body temperature, which can be calming. Physical exercise oftentimes has mental benefits much quicker than physical benefits. Exercising, which leads to reduced stress, also leads to reduced overeating. Specific types of exercise are meant to target and reduce stress. Yoga, an ancient practice that is said to bring the mind and body together. There's also a specific form of meditation called mindfulness-based stress reduction. Its purpose is to increase mindfulness through meditation by focusing on each part of the body systematically. Yoga and meditation combined together can bring peace to the mind. Stress takes a toll on all of us in one way or another, and individuals can relieve that stress through exercise. Exercise decreases depression. Like stress, people also know someone or are someone that struggles with depression. Physical exercise is a way to relieve some of the symptoms and lift your mood. Exercise lets an individual break from the negative thinking cycle. It allows the person to just work and run while not having to think about everything else going on in their life. Dr. Brendan Stubbs explains that our comprehensive review provides clear evidence that physical activity has a central role in reducing the burden of mental health symptoms in people with depression and schizophrenia. Our guidelines provide direction for future clinical practices. Specifically, we provide convincing evidence that is now time for professionally delivered physical activity interventions to more from the fringes of healthcare and become a core component in that treatment of mental health conditions. Exercise also provides more blood into the brain and lowers the immune system chemicals that actually worsen depression. One common side effect of depression is weight gain and health problems, and the lack of motivation to do anything. Physical exercise increases motivation and is a cheaper option to medication or therapy, which is difficult to afford, especially if you do not have insurance. Exercise can reduce the troubles that come along with depression. Exercise decreases anxiety. Last are the benefits of exercise has for anxiety. A numerous number of individuals suffer from varying degrees of anxiety. Patients who want to target their anxiety disorder will likely benefit from focusing on full body resistance training, which, with anxiety, one can build habits surrounding certain behavioral techniques that also go with exercise engagement. This creates better habits and more consistency with your exercise and will help ease the anxiety disorder. Like with depression, yoga is a great benefit to help anxiety. as well as meditation too. Because with meditation, it allows you to calm your mind and only focus on one thing, which is helping yourself be calm and collected. Anxiety is something that controls plenty of our lives, but with exercise, it can help relieve some of the symptoms and some of the pain that we all struggle with daily. Physical exercise increases body image. Exercising allows people to focus on their health and gain a better body image of themselves. People's body image usually lessens when going through puberty as a teenager. This affects their everyday life, and some become obsessed with their body image. Social media has a huge contributor to the poor body image. While it's been researched and there's not a lot of research surrounding it, there has been a clear correlation found between a poor body image with use of social media like scrolling through Instagram. A good way to get started with exercise, if one is uncomfortable going to a gym, would be to run outside or find friends who are willing to motivate you to work out with. It has been reported that body image oftentimes stops people from working out because they feel uncomfortable in their body and the clothes that they wear. Going to a gym scares them because they don't want others to be able to see them and see them in their most vulnerable state. With this information, it's found that body image can be a motivator for exercise, but exercise can also be a motivator for a healthier body image. This is already a base to start, and people want to exercise. If they are willing to start, then that is the first step of the journey. The study also discovered that negative body image was not a demotivator for exercise. Physical exercise increases self-esteem. Other than body image, there is self-esteem. With improved body image, exercise can improve self-esteem through consistency and a sense of achievement. Improving self-esteem can help combat the development of psychological issues that develop in young people. Self-esteem is especially hard for young adults dealing with social media. Referenced in the previous paragraphs, exercise has a way of changing and stimulating the brain. Exercise can affect the part of the brain called the hippocampus, which regulates mood and responses. This gets triggered by exercise and lifts your mood and self-esteem. Lots of people prefer to work out in private for fear of embarrassing themselves. This leads to a fear of exercising. Regardless of weight, size, gender, or age, exercise can quickly elevate a person's perception of his or her attractiveness. That is self-worth. Exercising quickly raises self-esteem, helping an individual become more confident in their body. If one takes the first step to exercising and then they gain confidence and raise self-esteem as well. Mental illness and exercise have a clear correlation in being able to benefit from both of them. If we exercise in a way that we are comfortable with, we can not only feel better about ourselves, get in better shape, eat healthier, we will also be able to decrease the symptoms that come with stress, anxiety, and depression, as well as raise our own body image and self-esteem. I know from personal experience that I have suffered myself with anxiety and a poor body image. I was wondering if anyone in the audience wanted to specify a time that maybe they realized if they were feeling bad or down that they went out and exercised and it made them feel better, made them like just their body feel better in a sense. I would love to hear from you. Thank you so much for coming to my presentation. I hope you enjoy it and that you will take something away from this today and that you will be able to go and use this and teach this to your students and allow them to gain a healthier body image and a better way to cope with their mental illness symptoms.